Hello, my name is Arminta Ray, and I am a third-year medical student at East Tennessee State University, Quillen College of Medicine, presenting today on a project called a pilot study of coping skills-oriented mental health intervention or interventions in a rural Appalachian school. This is a project that was truly born out of a direct response to community needs in the county where we work, serve, and train, and that is Johnson County, Tennessee, up in the very northeast corner of the state. It represented quite a pivot for us from our original plans for the spring of 2020, but a very necessary and timely response to online schooling in the beginning of the pandemic in March of that year. In the county where we serve in Johnson County, Tennessee has a disproportionately high rate of ACEs among its students, which are adverse childhood events representing trauma or environmental instability that can lead to a myriad of negative outcomes later in life, from mental illness to difficulties with education and employment. In this county, there's also a disproportionately minimal level of access to mental health services, so school system often function as the only point of contact for kids in this area. So feeling stressed at the beginning of the pandemic, with a loss of daily contacts with students, local educators invited and asked us to help with a very practical mental health intervention for their students during this time. So we responded by producing a 38-page resource guide filled with a variety of practical coping strategies and other mental health and well-being tactics presented in an easy to read and understand format that was distributed in both print and online formats to local educators. And it contained three main sections: one for teachers, one for parents, and one for students themselves. And with the support of school mental health and administrative staff, we distributed this guide via email to educators across all grade levels in April of 2020. And a few weeks later, we measured the response to the guide by distributing another online survey with 44 data points for completion by teachers who used the guide to assess the ease of access, usefulness of the materials, and likelihood of continued use of the guide in the future. We did find that overall, the guide provided information that was useful, applicable, and accessible for parents, students, and educators, especially surrounding how to really talk to students about COVID-19 and the stresses that it was creating for them in their lives. And 92% of our respondents reported that the guide met these expectations for teachers. And additionally, 93% of our respondents reported these parameters would also apply from their perspective to students and caregivers and parents. And as with all studies, we did encounter some limitations, and the ones from this study were centered mainly around our small sample size, which was limited to 26 local educators. There were no parent or student responses in our pilot study simply due to confidentiality concerns. The guide was also distributed to more educators than those who responded to our survey, introducing the possibility of some sampling bias. In the future, we would like to include more information in our guide addressing the stress of exposure to COVID-19, and that was a suggestion from many of the folks in our survey. We would also like to further distribute the guide to other school staff, such as custodians, bus drivers, and other support staff who have regular interactions with students, as well as community stakeholders such as churches and food pantries. But overall, this study suggests that the distribution of mental health resources in resource-poor school systems such as Johnson County is beneficial, informative, and an effective way to promote the mental health and well-being of rural youth. And we look forward to continuing this work into the future as we support youth in the region that we care about so deeply.